Here in Hamilton, public health authorities say there is now a high level of risk when it comes to the West Nile virus after somebody in the city tested positive for it. But despite the fact we see it every year, officials say we all need to remain vigilant. As we prepare to head into fall, it might be a bit surprising to hear about the risk of West Nile virus going up now. But
this is very normal for us to have our first human case around September. In fact, last year we had a human case within the same week.
Jane Morell at Hamilton Public Health says the region is right on its typical schedule.
We start trapping usually the end of June, and so second week of July usually we start to see positive pools because the mosquito population is established.
The virus is hosted in birds and is transmitted by mosquitoes. The good news is most people have mild to no symptoms.
That would be the majority of the cases. And those mild symptoms would be headaches, nausea, body aches.
But the virus can also have more dire consequences.
Paralysis, stiff neck, convulsions, disorientation. You might also see a rash.
In rare cases, it can cause death. In Hamilton, officials say there have been 19 pools where West Nile virus has been detected, and a few of those have had multiple positive tests. It's a bit higher than recent years.
Depends on our weather as well, too. When we have warmer springs, you'll see more positive pools because the mosquito population will be active sooner. If we have a milder winter, you'll also see a lot of mosquitoes survive.
While Morell says they've had hits across the city, East Hamilton, Lower Stony Creek, Bimbrook, and Flamborough were cited. Officials wouldn't disclose a list of specific locations. Down the QEW, West Nile virus is also present in Toronto. The most recent Public Health Ontario data shows 3 people have tested positive so far this year, and there have been 67 positive water pools. Positive human cases have also been confirmed in the Renfrew and Oxford areas too, along with positive water pools across Ontario into the hundreds. So when it comes to the threat the virus poses,
it's never going to go away. We obviously do things to try to mitigate and reduce the levels.
Things such as repeatedly putting larvicide in standing water as well as catch basins, and to keep monitoring. There's also a bylaw requiring residents to not keep standing water on their properties.
From June to September, individuals should be considering it's high-risk season because it's mosquito season, right? So you should be always taking those precautions.
Morell says when possible, people should wear shirts with long sleeves and pants, apply an insect repellent with DEET, and avoid mosquito-prone areas, particularly around dusk and dawn. In Hamilton, Nick Westoll, City News.